The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody. Does everyone have their tea and coffee ready? For some reason, we're having some technical difficulties. My screen seems to have frozen. All right, hold on, everyone. I'm not sure why my screen won't progress. It was progressing earlier this morning. Just a moment, hold on. All right, sorry about that, everybody. As you can tell, this is my solo flight, so I hope everybody will have patience with me. What's coming up today, you'll be muted. You won't be unmuted for any reason. This preserves call quality, although please note that we won't guarantee call quality for everyone or troubleshoot technical issues. Use the comment box to enter your questions, and since this is, again, my first solo flight, I'll only look and answer those at the end. You've all seen this before. While most of you will have generalized settings in mind that fit these boxes, do you also have local facilities you can suggest for the team? It may not be enough for some handlers to merely have a type of setting described to them. They will need concrete examples, otherwise they may end up visiting beyond their rating, or some may not visit at all because they cannot find or are unsure of where they do fit. If you have a happy-go-lucky dog, maybe a little exuberant, but very well-trained team with a supportive and proactive handler, you might suggest they would be good at a high school or college stress event, or even possibly an airport visit. Of course, before you even start suggesting settings or facilities, the best approach is to ask where the team sees themselves so they can use that and frame it with what you saw today, giving them a clear picture of not just their skills, but where those skills would be best suited to be utilized. Of course, the complex team is pretty easy to counsel. The rating says it. They can go with or without supervision and do pretty much what they want within the confines of the program's policies and procedures. But what about the predictable rating, and even more restrictive, the special qualifications? When it comes to applying the matrix to the predictable team, or predictable with special qualifications, try not to overgeneralize. Instead, try to be very specific. Some may already be upset that they got what they perceived as a lower score. Of course, we want to dispel that, and the best way is to have lots of examples of places they can visit with the predictable rating. Is there a senior day center needing teams? Perhaps there is a rehab facility in need of a team to work with one of the therapists. Neither place might be what the handler wants specifically, but it shows them there are choices and what those choices look like. Explaining only a setting and no specific facility or vice versa may end up frustrating the handler if they cannot, on their own, readily find just what you're speaking about. For example, we hear a lot about hospitals can be both complex and predictable. But if all the hospitals in your area only take complex teams, explaining a setting within the hospital that would be predictable is only going to cause frustration once the handler realizes there is no way the hospital will ever entertain what you suggest. So only use actual examples you're fairly sure you know to be available. Even if there is no space today, there could be one in the future. So it's very helpful to know the facilities in your area, not just what they do, but how they do it, as how they do it can be the difference between counseling a team, yes or no, to that setting. Qualification data. Here is the data from 2016. We have not run 2017 comparisons yet, but when we do individual TE reviews, the data for the most part reflects similar outcomes. Most evaluators will assign predictable ratings the most, complex second, and not readies come in a distinct third. Special qualifications and the matrix. When we recorded this in 2016, we asked the audience, do you often use special qualifications? If yes, what was the most common one? They said at the live recording that about 50% yes and 50% no. For those who use special qualifications often, one-on-one was mentioned most frequently. So we know they do get used, at least the one-on-one qualification does. So let's see if we can find the team a place to visit. We first need a place with supervision, not necessarily low activity, but we have said we only want the team engaging one-on-one with clients, not group visits. So in addition to where the team can visit, you could also quickly review where not to visit and why from what you saw today, especially if you saw something they thought they wanted to do, such as a high school stress event. If you have a dog who is older and slowing down, that setting probably is not going to work, but hospice might. If they had their heart set on kids, is there a therapist in the school who might allow them to visit, such as a speech therapist or a tutor? How about a read with me session if the library is willing to set it up for the team and the team is mindful of entering and exiting and the possible interactions they may face? They will still get to visit with kids, but in a far more controlled and supervised one-on-one setting. Routinely predictable. This is when we hope the team can find a senior residential living facility or a senior daycare. There will be supervision, if not with the team, at least close, and no one is probably going to be moving fast or in too ill of health. No medically fragile clients. This one is fairly easy. Healthcare facilities are probably not going to be suggested, but most of what has been suggested for other ratings, with the exception possibly of hospice, applies here as well. Low activity, few distractions. Not to pick on seniors, but they obviously be a choice here for visiting. Also, depending on what you saw, despite the predictable rating, this team might work well within medically fragile children. If the units in your area are like the one I know, there is a nurse or aide with each patient, and these are young patients aged 0 to 21 who will never ever leave the hospital. It takes a special animal and human to make these visits, and with a level of supervision, the low activity, and routinely predictable atmosphere, a case could be made for the predictable team who has the qualification of low activity and few distractions. Would that team fit in a similar setting somewhere else? Maybe not. So ask questions of the team you evaluate who are out visiting, and really get to know your local facilities if at all possible. And it will open up more opportunities for the team you evaluate. Making assumptions about facilities. Providing a specific example is not necessarily meant to promote that particular facility, but handlers do appreciate real-life examples that bring the matrix to life. And it is best to use an example from your own visiting experience, because then, of course, you aren't making assumptions. If you have direct experience with a facility in your area, you could mention it by name to the handler as an example of a predictable or complex facility and why it is such. What assumptions do we regularly see that may not be what they seem to be? Assisted living is a great example. The term assisted living is an umbrella term for facilities that serve, for the most part, our senior population. But be aware, because rarely will our teams get assigned to, say, the residential living section where clients are ambulatory and alert. Instead, most often the team will go directly to the lockdown memory ward. So what seems on the surface to be an easy, predictable visit is now maybe a complex, unpredictable environment. Can you think of other facility types that may seem to be best suited for the predictable team, but you still probably should offer a disclaimer that part of the visit or setting may not be as predictable as another, so be sure to remind the handler to discuss visiting expectations before accepting the volunteer opportunity. In 2016, when we recorded this the first time, we asked the audience, in addition to what's on the slide, are there other reasons you have seen for a team to wish to change the rating? Their responses were: handlers wanted to visit more complex facilities, so they work hard and retest even before a renewal. Animal is better able to focus. Animal is less interested. Handler is more polished and confident. Rating biases. Are you an evaluator who might have rating biases? Do you believe how a team prepares for their evaluation should have a bearing on how you rate the team? Meaning, are you possibly one who thinks those who took an in-person workshop seem to come better prepared, therefore they will get a more varied offering of possible places to visit or even a higher rating? Any eligible therapy animal team has the potential to earn a predictable or complex rating, regardless of how they took our course, despite the handler's age or the age of the animal. The evaluation is a snapshot in time, and you must rate the team from what they demonstrated to you during the evaluation only, taking no outside factors into consideration. While giving tips and advice will always be welcome, be mindful of why you are counseling as you are with any particular team. If you find yourself only telling handlers who took the online course they should take it slow, and you only offer the most predictable of facilities despite their complex rating, or perhaps you did not even consider the complex rating for this team, perhaps you have a bias. If it helps, we do not see any pattern in the way a handler took a course and incidents. So we urge you, if you do recognize any biases, to look at the data and realize it does not support that any one group will be involved in more incidents than another. Rating changes. Consider what you saw that caused the change. Was it that the team did not practice their skills, or that the animal just seemed to not want the interaction? If it is skills, this can be worked on, but the rating stands for today. As always, try to emphasize they are not a lesser team, so to speak, just because of the rating change. There may be some understandable disappointment if a handler's favorite facility requires a complex rating. The good news is many facilities across the country will not focus on a rating at all. Moreover, if a team now finds themselves in a position to look for new facilities, present this as a great learning opportunity and possibility to learn new skills. If you do need to direct a handler to a new setting that they may have to change up to match their rating, remember, if it's not easy, they won't do it. So telling them to tell or ask the facility to change how the visit looks probably won't work unless you know for sure it will, or who they specifically need to speak to make those changes. If you send them off to do the impossible, it probably won't happen, such as talking a facility that deems itself complex into taking you now that you are predictable. Remember, it is not your job as an evaluator to police where teams visit. We have to trust them. But to trust them, we need for you to be very clear and demonstrate what you saw and did not see that caused their rating to change. Perhaps Max is no longer consenting to interactions. Max will allow you to pet him, but won't seek out more and turns away after the first pet. If you ask some questions and give your formative feedback, you and the handler may together understand what occurred for the rating to change. Be sure to focus on the actual evaluation exercises. Keep redirecting the handler back to the day's exercises, as that is what matters to today's rating. And of course, you may remind them they can always evaluate again for a rating change. So the rating changes from predictable to complex. When this happens, we ask for you to share some ways in which their visiting experiences may change, not just in terms of louder noise or more activities, but you must also highlight the types of personal encounters experienced by you, the evaluator, i.e., working in a sexual assault crisis center may be far more taxing than visiting a college campus during exam week. It's helpful to remind handlers to do what works for them. While the door may seem wide open, that does not mean the team needs to walk through it. Doing a pre-visit tour of the facility without their animal can help the handler get a better sense of what they can expect. Complex teams can continue to work in only predictable settings and have no obligation to change how or where they visit. This is also an acceptable option. Better be safe than be in over your head. Lastly, it is important to balance out the feedback. Even though a newly complex rating is a sign of greater skills, handlers should be careful not to assume that this means they are an invincible super team. In chaos or emergency, complex teams, new complex or experienced complex, should still excuse themselves. New facilities are coming to us each day. A few years ago, who would have thought our teams would find visiting in a busy airport to their liking? Walk with me. While it may not seem out of the box to some, it was to me. I cannot tell you how disappointed I was this initiative came out after my team retired. Walk with me requires no facility. It can be arranged in a variety of ways. And in the case of a dog, it is something they do and probably like to do. So if you see a team that likes to walk, do not forget to suggest walk with me activities. In addition to what is here, our live webinar audience shared additional possible locations for visiting. Those included summer camps, infusion centers, detention centers, bite prevention programs, flu shot clinics, police departments, waiting rooms at various types of facilities, visiting a child with special needs to help them learn how to interact properly with an animal as they are waiting for their assistance dog, and finally, foster care centers and working one-on-one with a child. Familiarity. An evaluator who's familiar with the animal in a team shouldn't evaluate that team. An evaluator is considered familiar with the animal if the animal has become habituated enough to the evaluator that its behavior is influenced either positively or negatively. You might become familiar with a team as the instructor or assistance of obedience, agility, or therapy dog training, or through grooming, friendship, or similar interactions that bring you and the team together on a regular basis. However, if you only interact with the team when it's evaluated, you wouldn't be considered familiar with the team. It's important that team evaluators be seen as fair and unbiased in their decisions. For this reason, don't evaluate close friends or family members. Ultimately, you're responsible for making the final judgment about whether you're too close to the team to make a fair assessment. However, in situations where your relationship with the team might open you up to questions of bias, it's best to have another evaluator conduct that team's evaluation, and also be aware during our review, we may also question your decision, especially if you're in an area with multiple choices, yet you still evaluated the team evaluator you do evaluations regularly with. Familiarity also applies to space and locations. Certain locations, if familiar, can incite a positive or negative response in handlers and animals. The sights, smells, sounds might invoke reactions. For an example, an evaluation occurring in a doggy daycare that a particular animal visits, that could cause a dog to grow nervous as it will be left, or it could cause a dog to grow excited because he believes it's time to play. Different behavior can result in a known setting versus an unknown setting, and we do expect our teams will often go into unknown settings. So it is our duty to simulate that experience via the evaluation. How will the animal and handler perform when in a new place? A location is considered familiar if the handler or animal has habitually spent time there in the last 2 years. Familiarity with location is generally more of a concern for animal than the human, but both should be considered. We all want an accurate read on teams. After all, without accurate reads, teams could be less safe and a poor reflection on all teams. Furthermore, insurance requires that we take reasonable precautions to ensure the team is reliable in unfamiliar situations, and we can only test for that if we really create that condition during evaluations. Imagine a worst-case scenario. A therapy animal team seriously injures someone during a visit and a lawsuit is filed. The first question everyone is going to ask is, how was this animal or team determined to be safe and appropriate? In reviewing the evaluation for the team, if it was determined that there was possible chance that the evaluation was not objective, that would negatively impact both the individual evaluator as well as the therapy animal program. I do stress this is a worst case scenario, and it has never happened. But the world is changing, and our teams are going to new places with new expectations. Will they be ready? If you know the handler or animal really well, how will you know what they are like when they are not as comfortable as they are with you or their surroundings? And how would you even be able to tell? Finally, evaluators are seen as program leaders. If you pass a familiar team and don't pass an unfamiliar team, even if the passing decisions were the right decisions, the perception of the team that not readied, as well as the perception of the others in the room, could be that personal relationships are more important than the quality of the teams. Here are some scenarios. Evaluators evaluating one another. Obviously, this is a necessity. However, we ask that you be mindful of which evaluators are evaluating each other, especially since many evaluators work together in pairs or triads. If you frequently and almost exclusively work together with another evaluator, the best choice is probably not to evaluate one another. Why? Because even if you feel you can be unbiased, the perception on the part of the handlers, many of whom see you working together always, may be that you are indeed biased. Solution? Don't get evaluated by the person you work with frequently. Or work with different people. Rotate around. Evaluate on your own once in a while. Demonstrate to others that you aren't part of an exclusive pair or triad. Evaluators visiting with handlers. Most of our evaluators are active handlers. This means that you may end up volunteering alongside handlers who you have evaluated or will evaluate in the future. If you are visiting monthly with a team, that would absolutely constitute habitual familiarity. The animal knows you after all. They are used to seeing you regularly and in a therapy context. If you visit alongside a handler only occasionally, that's a different story. Solution? Don't visit with the same handlers frequently, or if you do, recognize that there exists a relationship and refer them to another evaluator. Just be mindful that if you are the only evaluator in the area, you are putting the handler in a difficult position. This may be unavoidable, but be aware. Evaluating members of your local group or community partner. There really is no problem unless if a strong personal relationship or friendship develops. Otherwise, seeing someone at meetings or occasionally attending events together is not an issue. Evaluating someone who is familiar. Very occasionally, an evaluator will need to evaluate someone with whom he or she is familiar. In such cases, only a predictable rating can be given. In real life, this means that many handlers and evaluators will ignore the familiarity policy and go ahead and apply a predictable rating. However, this isn't actually following policy. Handlers are required to be evaluated by someone else as a first choice. Only if there is no other evaluators available within 3 months and within approximately 50 miles can a handler consider evaluating with a familiar evaluators and taking the predictable score. And if you have one, use an experienced assistant. The same rating applies, but how the experienced assistant got to the predictable could be vastly different than the familiar evaluator, and you also have created distance, which is never a bad thing in the case of familiarity. Remember, first and foremost, the evaluation is intended to assess the team in unfamiliar settings with unfamiliar people. That is the core of the PPSAT. So we're always going to try and have that established regardless of rating. The predictable only rule is a backup safety measure only in emergency circumstances. All right, does anyone have any questions? We will take some time to look at those if you do. All right, let's see. I once evaluated a retired show cat who was wonderful, and the handler had her heart set on our local hospital. Guess what? Hospital would not accept other species. We are seeing increase in species becoming pet partners. Good to know ahead if the places will accept them. That is a very good point. When you are evaluating like mini horses or llamas or alpacas, you will want to be sure that where you're sending them off to is going to be someplace that they'll actually be able to visit at. And we have another comment: just because an animal gets a complex doesn't mean it will be comfortable in any complex place. And that is absolutely correct. We do need to always consider where the animal wants to visit. We want to counsel the handlers to look to their animal when they are on a visit to see how they react, how they're consenting. And if they're not consenting, but they have a complex rating, maybe it is the fact that it's just not the setting that animal wants to have. Let's see, do we have any other questions? We'll hold on here for a couple minutes to see if we have any more questions. I'm not sure if anybody's asking them or I'm just not seeing them. Like I said, this is my first solo flight doing this. So needless to say, I was a little nervous. Well, I'm not seeing any more questions. Oh, here we go. What is the guideline again for an experienced volunteer can be used? Okay, if you are the only evaluator in town and you have a team coming to you who you are familiar with, we don't even have to worry about the guidelines on it. You can go ahead and use an experienced assistant. Otherwise, we would ask for them, the team, to travel. I know a lot of teams don't like to travel, but that's, that way they can get the complex rating. Again, if they're going to go with an experienced assistant, they're only ever going to get a predictable. For some people, that doesn't matter. For other people, it does. If you have an evaluator, know some fellow evaluators are evaluating each other on a regular basis. What should you do or not do? Actually, we're not asking you to be Pet Partners Police. So when the paperwork comes in, operations reviews all the score sheets. We also look at the calendar event. So if we see 2 names on there and we see that you evaluated each other at the same event, I'm sure that operations is probably, if nothing else, going to just shoot you a quick little email and ask about, was there other choices and why did this happen? And then they'll make a decision from there. And then we have a good, someone says they use a questionnaire to ask the team what type of facilities they would like to visit. This helps them guide correct facility. Well, that's a good suggestion. And then someone else says we try to teach to be aware that any predictable situation can turn complex. A quiet nursing home and someone faints near you in the hallway. Exactly. We do know, always make our teams aware. Predictable or complex. When something happens, somebody faints, you go to get help and you move out of the way. If the fire alarm goes off, you leave. You don't hang around. You're not there to offer therapy during a crisis. We do ask that regardless of your rating, that you would leave, that you would step away and let the professionals handle it. We'll wait a few more minutes here and see. I know it takes a couple minutes to type your questions in. I do appreciate everyone who got up on a Saturday morning to listen to this webinar. Familiarity has become quite an issue when we're doing the review, because we are looking at it. So we want to make sure that we're very clear It's not about you. We trust you all implicitly to be not biased when it comes to familiar teams. But as you can see, it's really about having an unfamiliar setting and unfamiliar people so we can see how both the animal and the handler handle it. Someone's made a comment that they have teams who travel a long distance and the animals sometimes are more stressful due to the travel. Yes. I've had some teams. I had one team come to me. She had driven 4 hours. She always had a predictable rating, or not predictable. She'd always had a complex rating. And when she showed up, I think it was because of the stress of the drive that she got a predictable. So she was pretty upset, but she didn't have anything close, and she hadn't asked us. Now, we can provide alternates to renewing teams. So if you had somebody who was absolutely familiar to you and you did not have an experienced assistant, which is someone who's helped you with 20 teams as an evaluation assistant, then we could actually, you could come to us and we could look for an alternate. We do have many alternates around the country who can step in if need be. Now we have a question, would it be an evaluator's duty to report a handler who is visiting out of their qualification if we are aware? No, you don't really need to. Again, we're going to trust the teams. We trust the teams and the facilities to make the right choice. We will hope that nothing happens. If it does, that would be the time that we would take it up with them. What if someone insists on evaluating their animal back-to-back with different handlers? Absolutely not. I would have to question if the handler is practicing being the advocate of their animal, if they would actually go through an entire evaluation and expect the horse or rabbit to go again straight through that evaluation. And again, if anybody ever gives you guys a hard time or says, I need this, that's what I'm here for. I know you can't get a hold of us on the weekends, but come Monday morning, we can definitely be on top of that. So if you have someone who's giving you a hard time, you just say, I'm sorry, I can't answer that question, or maybe you're just going to have to send them away for that day. But that's best to err on the side of caution and to get a hold of us on Monday morning, and we will definitely have your back. Do we have any more? Should we wait here another minute or two before everybody can go off and enjoy their Saturday? Well, that's nice. Someone just said they love the support that Pet Partners gives evaluators. We appreciate that. Well, if we don't have any more questions, we're going to wrap this up. I do want to remind everybody that within a few days or a couple weeks, we'll probably have this up in the resource library of the Pet Partners website. That is, if I've done an okay job. Felice will be the one to tell me. So it may or may not come up. If you think of other questions, as you go through the day or over the weekend, please, you can always send them to me. Someone has just re-emphasized that the phrase you said, err on the side of caution, has really helped me in the years of evaluating. It's true. Nothing can happen if you don't evaluate that team that day. If you don't give that score that day, nothing's going to move forward. Nothing bad's going to happen. Nothing good might happen either, but nothing is going to happen. So always erring on the side of caution with maybe the lower rating, or like I said, with the not ready for that day, or not even evaluating that team if you're unsure. All righty. I'm going to give this just another minute to see if anybody can think of anything else they would like to ask today, and then we'll go ahead and send you on your way. All right, doesn't look like there's going to be any more questions. I do, again, appreciate you taking your time this morning, and this will be in the resource library. We will be sending an email when it is available. So I hope you have a lovely day. Thank you.